Hi, my name is Margaret Yang. I'm one of the PhD students in the Educational Psychology Department. I wanted to thank you for giving me the opportunity to give this presentation. The title of my presentation is A Multifaceted Approach to Improving the Mental Health of Health Profession Students. Just a little bit of background about myself. I've been working at the University of Pennsylvania School of Dental Medicine for the past 6 years. I've always been interested in working with students in mental health capacity. And recently, since I started working with dental students, I've realized how little research there is out there on how to support this student population. So I wanted to write my qualifying paper on this topic so that we can bring more awareness to this particular student population. First and foremost, it is important to talk a little bit about why health profession student mental health research. So besides the fact that I work at a dental school and that this topic is very personal to me, there are several other reasons why this is such an important topic. There has been significant research done for undergraduate students when it comes to mental health, but really not so much so for health professional students. There was a study done in 2021 where Satinsky and her colleagues conducted a systematic review of depression, anxiety, and suicidal ideation among PhD students. Of the 16 studies they included for their meta-analysis, they included 23,469 PhD students. They found that the prevalence of clinically significant symptoms of depression was 24%. This is for PhD students. Now, for general population, that number typically ranged between 5 to 7%. More interestingly, there was some studies done within the health professions population, mostly focused on medical students, and they showed an even higher rate of depression of medical students and dental students compared to PhD students. A meta-analysis conducted by Puthran and colleagues, they found that of the 62,728 medical students included in their study, the prevalence of depression was 28%. In dental, there was another study done in 2021, and they found that the prevalence of depression was 37%. Now, this 37% was higher than medical students and significantly higher than PhD students, and not even talking about the general population. So this is why it's so important for us to focus on this population. Now, of course, COVID-19 has disproportionately impacted the mental health of health profession students, and we'll go over that in a later slide. But these are the future healthcare providers. They're going to be the one that care for the well-being of others. So it's extremely important for us to figure out what it is that's impacting their mental health and how we can help them. In order to have a better understanding of what these students go through in order to graduate from the schools, we must first better understand what these students have to go through in order to even be admitted into many of these health professions programs. The admissions process for many of these different health professions fields look somewhat similar, so I'm not going to go through them one by one. However, it is very important to understand that these students actually have to have very strong science foundation and background in order to be admitted into many of these programs. So going into their undergraduate institution, many of these students already know that they wanted to go into the health professions field after they graduate from their undergraduate institutions. They go through their undergraduate process and they wanted to make sure that they receive good grades in all of their courses. And then they go through the admissions process for these health professions programs. The cost of the admissions for these programs can be extremely high, especially if students apply for 10 plus programs. In addition to the admissions process, the admissions application they go through, most of these programs require interviews for these students. Pre-COVID, most of these interviews are in person. And so students then incur the cost of traveling to different institutions so that they can interview for these programs. And that's an additional layer of cost. And the interview process can be extremely challenging for these students because oftentimes they only have 30 minutes to an hour to impress the admissions committee, to convince the committee that they are passionate about healthcare, they want to go into these different health professions fields, and that they are able to succeed in their institutions. After they are admitted, they then go through a series of extremely rigorous courses in order to graduate. But just graduating from these schools are not simply enough. They have to either take the board examination or they take licensing exams to even have the opportunity to practice as a practitioner. So as we can see, even the process of getting accepted into these schools can be extremely challenging for these students. They utilize a lot of their energy and resources even before they start the programs. Now that we have a better understanding of why it is so important for us to discuss the mental health impact of health profession students and some of their background and what it takes for them to get into these programs, we can start looking at some of these mental health issues that impact health profession students. The first factor I'm going to look at is called imposter syndrome. There are 6 different types of imposter syndrome. I'm going to go through each of these one by one in the next couple of slides. The first type of imposter syndrome is called imposter cycle. Imposter cycle is actually somewhat similar to what we call superheroism, which is the third type of imposter syndrome. For students who experience either imposter cycle or superheroism, they over-prepare for an assignment because they believe that they're just not good enough. And so they typically actually either prepare excessively or they procrastinate to start the assignment because, again, they feel like they're just not good enough and they feel like their assignment may not be good enough. So oftentimes these students actually are the ones that suffer in silence. They don't tell anyone that, this is what they're going through. So even if, sometimes they're the ones that are not submitting the assignments, faculty may think that they don't care. But instead, they really just have a really hard time submitting the assignments because they just don't think that their product is good enough. Now, the perfectionism is the one that I really want to get into. So this is another type of imposter syndrome where students set exceedingly high standards for themselves and they want to make sure that everything they do is perfect. So there was a survey that was conducted in 2019 that looked at the relationship between perfectionism, maladaptive professionalism, or I shall say, and shame or embarrassment in first-year preclinical medical students at the University of St. Louis. So they actually surveyed 169 students and over 25% actually met the criteria for maladaptive perfectionism. 54 students, which is a little over 30%, 31%, had high or intense imposter phenomenon scores. And they found that students who meet the criteria are much more likely to feel shame, embarrassment, or inadequacy when it comes to their coursework. And this can lead to high level of anxiety and depression. The next type of imposter syndrome is called a tachyphobia, which is also fear of failure. This is where students have the tendency to avoid failure because of humiliation and the embarrassment of failure, and that is perceived to be extremely overwhelming. That's interesting because while there's been no formal research on fear of failure within the United States, a study within medical student population at King's University showed that fear of failure actually impacts both high-achieving students as well as students with academic struggles. So this isn't just a problem for high-achieving students, but it also impacts students who struggles a little bit academically. Interestingly, there's some contradictions in the research because some research has indicated, Hewicker in 2023 had done some research on imposter syndrome, and they had showed that imposter syndrome disproportionately affects high-achieving, high-functioning individuals, which, also makes sense. I think that the important thing to take away from the research is that, imposter syndrome impacts many different types of students. Perhaps they disproportionately impact high-achieving students, but it also impacts students with academic struggles. The next type of imposter syndrome is denial of competence or capability. This is when people internalize success because of the need to be more competent than their peers or their mentors perceive them to be. And the last kind of imposter syndrome is fear of success, which to some people may not make any sense because, well, why wouldn't you want to be successful? Why would you be afraid of being successful? Well, success comes with pressure, and students feel like if they're successful, there's the pressure of achieving more and the doubt of self-worthiness if they're not achieving more. In a 2018 study examining the level of imposter syndrome in dental students at a small Midwestern university, there were 120 participants that were surveyed, and almost 60% of them exhibited clinically significant level of imposter phenomena. So, this is a really interesting topic that really should be examined more closely on health profession students. Now that we see how imposter syndrome impacts a lot of these health profession students, not just high-achieving ones, but a lot of other ones as well, we can look at some of the additional factors that impact the mental health of health profession students. So the first one I wanted to discuss is called faculty-student relationship. We all know that faculty-student relationship is extremely important. While there are a lot of studies that exist for undergraduate students regarding the importance of mentorship, there really are not a lot of research done for faculty-student mentorship for graduate students. And so we all know that a supportive and positive relationship can foster a healthy academic environment for these students. And so really it's incredibly important for there to be mentorship so that the faculty members can nurture the students' academic and personal growth. And a positive relationship include items such as constructive feedback, open communication, and the ability to refer students to different resources on campus when needed. So faculty members are often role models, and they can provide guidance and affirmation to these students. Now, on the flip side, an unsupportive or strained relationship can really harm a student's mental health. So factors such as lack of support, unclear expectations, excessive micromanagement, or even harassment, right, can really lead to heightened anxiety, stress, and depression for these students. And so there are a couple of studies out there that shows how faculty mentorship impacts students' mental health. So in 2018, Evans and colleagues conducted a study where they saw that half of the graduate students that they surveyed did not feel that their PI or advisor offered any real mentorship, which led to them being significantly impacted on their emotional well-being. In the University of California Graduate Student Well-Being Survey from 2017, and they surveyed 11,000 graduate students from U.S. schools, they found that a quarter of the respondents felt dissatisfied with the mentorship and advising they received from their advisors. They feel that they reported significantly high level of dissatisfaction with their academic career, and they really saw that their mental health was significantly impacted through this process. So another study done in 2008 focused on economics PhD students in the US. They found that 27% of women and 35% of men perceive their advisors as lacking concerns for their well-being. And additionally, 36% of students reported not having had any informal discussions or formal discussions with their faculty about their academic or professional growth. And this is really concerning, right? So we see that it's really important for there to be positive and supportive mentorship between faculty and students. Now, I do want to also highlight that yes, it is important for faculty to be supportive for the students, but it's also important for faculty to be supported throughout this process. because faculty do find that working with students facing mental health challenges can impact their own ability to teach if they are unprepared to support students. So in a 2017 study of nursing faculty, they found that, having to support students in a mental health capacity really impacted faculty's mental health as well. So in this process of faculty supporting these students, it is incredibly important for faculty to receive proper training and proper support as they're also supporting their students. The next factor that impacts health profession student mental health is work-life balance. Many of the students feel that they're expected to treat their studies as a full-time job. In a survey conducted by Nature in 2022, the participants that were surveyed, they found that 70% of participants dedicate more than 40 hours per week to their program, and over 50% of respondents reported that they're expected to work overnight shift within their schedules. That's very challenging for these students because in addition to having to go to classes, they have to spend a significant amount of time outside of school to dedicate to their studies. And then many of the students are parents or they care for the elderly. So they have to balance school and care for their dependents. In a 2018-2019 Healthy Mind study of 6,131 doctoral level graduate students, the study found that 1 in 5 respondents was a parent. So that's 20%. Yet most schools do not have parental leave policy for these students, and they do not have dedicated support for students who are parents, let alone students who are supporting the elderly, right? So for these students, not only they have to balance their school, their self-care, they're having to care for someone else outside of school. Another factor that kind of impacts work-life balance is the significant amount of financial burden these health profession students face. Now, granted, we understand that these students have probably a higher earning potential than some of the other students. But get this, for medical students, the average medical school graduate owes just a little over $250,000 in student loan debt. And over 73% of those students, this debt is just coming from medical school. For dentistry, the average dental student loan debt in 2022 was $293,900. Dental student loan debt affects over 83% of dental graduates. Veterinary students has an average of $147,000 in student loan debt. So even though their earning potential could be higher, you're looking at $250,000 when you graduate school in student loan debt. And that can be extremely anxiety provoking. And last but not least, because of the financial burden, because of potentially having to care for someone else, they may have multiple jobs while they're in school. And how do you expect someone to be dedicating more than 40 hours to their academic studies, care for their dependents, and at the same time hold multiple jobs? So we can see how work-life balance really impacts these students' mental health. We saw that in a study conducted by Galia and al. They found that the impact of work on the mental health of 153 PhD students, they saw that the prevalence of anxiety is 68%, and over 50% of students experience depression because of work-related burnout. So this is really a very important topic that impacts the health profession students' mental health. In addition to faculty-student relationship and work-life balance, many students, especially in dental and medical fields, feel that they are pressured to conduct research. There has been increased competitiveness and decreased funding from the government, which lead to significant stress for students who want to participate in research. For many of these students, they have to balance the challenges of their curriculum as well as the substantial amount of time commitment they have to put into their research pursuit in order to be able to do both. And for a lot of these students, even though some people are genuinely interested in conducting research, a lot of students use research as an opportunity to boost their resume so that they can get into residency programs, as many of them believe that residency programs look for students who have done research in their either dental school or medical school career. So, and this takes away opportunity from students who are genuinely interested in conducting research. So this is problematic for people who are genuinely interested in conducting research, as well as those who may not be so interested in research itself, but rather use this as an opportunity to boost their resume. Another factor that contribute to the health and well-being of health profession students and graduate students is uncertainty about their future career. In a 2022 survey conducted to graduate students in a global setting, the study revealed that only 62% of students actually express any contentment in their chosen field. So this survey was done in 2022, and when they did that same survey in 2019, the number was 71%. So that was a 9% decrease of contentment level in their chosen field. Of close to 3,300 survey participants, most of them discussed things like work-life balance, financial concerns post-graduation, and ambiguity surrounding their career trajectories after they complete their studies as some of the stressors in their lives. In addition, the surveys also found that pressure to secure postgraduate training opportunities or desired jobs can lead to fear of failure, which was one of the imposter syndrome symptoms. Compared to graduate students in other fields, health profession students experience even more unique stressors that are related to their studies. For example, many students have to balance between clinical rotations, patient care, and their rigorous academic curriculum. Take dentistry as an example. Most of these students have never had any sort of patient care experience prior to coming to dental school. They may have had some shadowing experience, but shadowing a dentist is very different than being a dentist. By the third year, these students are treating patients independently, and oftentimes this creates significant amount of stress for these students because they are overseeing someone's health and wellness in their career. Additionally, there are patients who have issues such as prior negative experience with healthcare providers or dental fear. So these are factors that we have to take into consideration when we work with dental students. Another factor that is unique to health profession students is the pressure to pass licensing exams. So it's not enough for the students to just graduate from their prospective schools. They actually have to pass the licensing exam in order to become a practitioner. Let's take the medical field as an example. The United States medical licensing exam, it takes well over 30 hours for students to complete. The first portion is taken right after the student's second year of medical school, and that usually is about 280 multiple choice questions on the basic sciences. After this, the students take a second portion of exam, which is another over 300 multiple choice questions that spans for just over 2 days. And lastly, students have to take a third portion of the medical licensing exam, which is usually taken right after the first or second year of their residency. So as we can see, it is not enough for the students to just graduate from the schools. They actually have to pass these exams in order to practice. Take dentistry as an example. The students must pass the Integrated National Board Dental Examination in order to even graduate in most of the dental schools. These exams takes about 2 days, 12 hours and 30 minutes to complete. And students typically take the exam at the end of their third year. Now, if the students want to practice dentistry, they then have to take what we call 8X, or in California, they have a different type of exam. But these are the licensing exams students have to take in order to pass, in order to practice as practitioners. Last but not least, students have to choose between specializing or being a generalist. and the pressure of applying to specialties is enormous. Students have to submit an application to the specialty programs and take enormous amount of time and money to interview at these specialties. And then the students, if they do end up getting into a specialty, that's another, depending on what specialty they get into, that's another between 1 to 2 years to potentially up to 7 years of additional studies they have to go through. After we look at the factors that impact graduate students and health profession student mental health, I wanted to take a look at the current landscape of health profession student mental health. Unfortunately, the suicidal rate among male physicians is over 40% higher than among men in the general population, while female physicians are at an even greater risk, with their suicidal rate being 130% higher than among women in the general population. This is another reason why this is such an important topic. Even so, the research on this topic has been completely inconsistent and scarce. Most of the research are focused on medical students compared to other health profession fields. So it's important for us to do research in the population in the other health professions field. Moreover, most of the research focus on foreign students. Very few studies have been done in the U.S., and those studies that were conducted in the U.S. have been very small-scale studies. Now, after looking at the very dreary statistics of health profession student mental health, someone may ask, so why don't they seek help? In the next couple of sections, we're going to look at obstacles to health profession students seeking psychological support. As you can see, there are primarily 5 different factors that are preventing health profession students from seeking support, and we're going to go through each one of these individually. The first one is self-disclosure and help seeking. The first one we're going to look at is self-disclosure and its relationship to help seeking. Many people who are applying to licensure are scared of seeking mental health support because they feel that seeking support can decrease their chance of getting licensed. In a statement provided by the American Psychiatric Association on the disclosure of mental health issues in the licensing process, they find that disclosure stigmatizes individuals who seek consultation and treatment. It equates help seeking to behavior with the existence of problems sufficient enough to cause impairment. They single out psychiatric treatment for discriminatory attention and exposes those who report treatment to breaches of confidentiality. So the APA has been advocating for licensing board to only ask questions that pertain to current impairment, which can impact someone's capacity to function as a competent physician instead of their history of mental health issues. Similarly, the United States Supreme Court ruled in 2014 that in order to be compliant with the ADA, medical licensure agencies should limit mental health related questions. However, looking at a survey sent to the licensing board executive directors, 37% indicated that a mental illness diagnosis alone could lead to sanctions against physicians. So people are getting very conflicting information from these different agencies. In 2018, the Federation of State Medical Boards released different recommendations for different medical boards to comply with the ADA, and one of which being that mental health questions should only be used if there is a current impairment, which would allow for a safe haven for non-reporting and include supportive language for normalizing physician wellness. So self-disclosure and being compliant with the ADA can be conflicting with each other, and this is one of the reasons why so many students decided not to seek support because of self-disclosure reasons. In addition to self-disclosure, stigma is one of the biggest barriers to students seeking mental health support in the health professions field. Stigma, by definition, is prejudice and discrimination that disproportionately affect individuals grappling with mental health challenges. There are two different types of stigma. There is self-stigma and social stigma. Self-stigma, by definition, means how one perceives themselves, judging themselves for doing something, and social stigma pertains to how others perceive them. There are a lot of research done on how stigma impacts people's ability to seek mental health support. In 2002, Givens and colleagues found that stigma was the main barrier to the use of mental health services by 30% of first and second year medical students experiencing depression. In 2012, a survey was sent to 2,449 medical students from 6 different medical schools. Of those students who responded, only 30% chose to seek help because of burnout. Students who did seek help reported to be twice as likely to have observed supervisors negatively judging them than those who did not seek help. Interestingly, while many students are impacted by stigma, and while that's one of the reasons why many students decide not to seek support, research have also found that most medical students do not actually judge others for seeking treatment. So again, we have a misalignment between people's perception of what could be construed as stigma and what the reality actually is. Related to the previous two obstacles, privacy and academic and career impact are two other obstacles to why health profession students do not seek support. First of all, many students have the perception that if they did seek mental health support, faculty, their peers, their parents, or potential employers could gain access to their mental health record. And this in turn would lead to severe impact on their academic and career. They feel that if they revealed a mental health challenge, they would be judged by their employers. A comprehensive literature review conducted in 2023 analyzed 33 articles exploring the barriers medical students face concerning mental health disclosure and help seeking. The literature review identified stigma and privacy concerns as key reasons why medical students are reluctant when it comes to mental health support. A study conducted in the UK, they found that despite 80% of students being aware of resources being available for mental health related illnesses, only 21% actually chose to disclose their mental health challenges and seek help. We had just looked into 4 major obstacles that prevents health profession students from seeking support. Now we're going to make it even more complicated and add in cultural influences. International students in this country face even more unique challenges. Some of them have never lived far away from home before. Some of them have never taken courses in English before. So there is the feeling of isolation and homesickness. They have to navigate a challenging curriculum in a foreign language. On top of that, they have to navigate the U.S. educational and healthcare system, which is completely different than many parts of the rest of the world. As an international student myself, I came here at the age of 14 and a half, and I really didn't speak any English. I came here, I went and lived with a family that I knew nothing about. I had to speak English every day, and I was homesick, and I was physically sick all the time from the amount of anxiety I was going through. So international students face even more challenges compared to the rest of the other health profession students. Now, additionally, in many countries of the world, mental health issues are not discussed. People don't believe that mental health issues are real. So there's very scarce utilization of mental health resources for international students. Research shows that international students are much less likely to utilize on-campus and off-campus mental health resources compared to their domestic peers. So we just went through 5 different obstacles that prevent health profession students from seeking support. The next session will talk about the impact of the pandemic on health profession student mental health. Everything seemed to be going somewhat normally at the beginning of 2020 until COVID-19 happened. We all pretty much packed our desks to go home with moments' notice, and a global pandemic happened. And this, of course, severely impacted the health profession students the most because they're the ones that are in the front line of healthcare. Couple of reasons why COVID-19 impacted health profession students. First of all, lack of social support and the feeling of isolation was something that everyone was going through. Many students have thought of exiting the health professions field. In a study conducted within dental students at the University of Washington, they sent a survey to students looking at whether students intend to leave the dental profession after COVID, and 13% of students revealed that they intend to leave the profession. 22% and 16% of participants endorsed clinically significant anxiety or depression symptoms, respectively. And almost 70% of students reported that COVID-19 affected their overall mental health. So students were experiencing severe anxiety and depression levels, and COVID-19 impacted students all over the world, not just in the US. As I mentioned at the beginning, my topic is a multifaceted approach to improving the mental health of health profession students. So we've talked a little bit about how faculty can help support students, what are some obstacles students go through, and now we're going to look at resiliency in health profession students, because I don't believe that this is a one-way street. I believe that there has to be multiple approaches to this one problem. According to the American Psychological Association, the definition of resiliency is the process and outcome of successfully adapting to challenging life experiences. There's a lot of debate out there on whether resiliency is something that can be improved, and I fall into the camp of yes, resiliency can be improved. Research have shown that resiliency score in health profession students is extremely low. A study done in 2017 showed that they had done a survey on first-year Turkish students in different health professions fields, such as dentistry, pharmacy, medicine, and health sciences. They saw that the resilience score is 143 out of 250 amongst 492 students surveyed, which is incredibly low. They had a couple of suggestions as to why the resiliency score was so low, and one of which is that they found that parents with low educational level produce students with high resilience scores, and parents with high educational level produce students with low resilience scores. That gotta make us feel good, right? As we're getting our PhD. However, there's a contradictory findings in the same study where they found that the higher the quality of life provided to the students, the more resilient they are. You would think that parents with higher educational level could provide students with higher quality of life. However, they found this contradictory finding that the higher the quality of life provided to the students, the more resilient they are. So this contradictory finding makes it really challenging for us to figure out how to improve resilience scores of students. One of the challenges of even trying to improve resiliency scores is that there is no universally accepted definition of resilience. Like I said, some people believe that resilience cannot be improved. They are born with a resilience level, and that's what it is. Others believe the other way around. However, whatever the definition is, whatever camp you may fall in, researchers are calling for improving the resilience level of health profession students. So The other part of the multifaceted approach is, how is faculty able to work with students in distress? Is it even their responsibility to work with students in distress? The Boston University School of Public Health partnered with the Mary Christie Foundation and the Healthy Minds Network. They piloted a survey aimed at understanding faculty members' perspective on the current state of student mental health and behavioral health. They surveyed 1,685 faculty members at 12 different colleges and universities across the United States, ranging in size from 2,000 students to 20,000 students located in 10 different states. Some crucial findings include 80% of these faculty have had one-on-one meetings, conversations, phone calls, or email exchanges with students regarding their mental health. Yet, only 51% feel that they have a good idea on how to recognize students in distress. More importantly, 61% of them believe that mental health training should be required for all faculty, and 73% welcome additional training and professional development on supporting students in a mental health capacity. While the study is somewhat comprehensive, it includes mostly faculty members teaching in undergraduate institutions. And so here's the breakdown. Among those who teach, 39% taught at both graduate and undergraduate institutions in the past 12 months. 53% taught only undergraduate students, and only 6.9% taught only graduate students. So there have never been a study focusing on exclusively faculty who work with graduate students, or even less, health profession students, their ability to support these students. The faculty members are the first people students reach out for support, which makes sense. They're the ones that students see every day. They're the ones that are very visible for the students. Yet, many of these faculty members feel incredibly unsafe and uncomfortable even around students in distress. A study conducted by Baker and colleagues surveyed faculty members in one institution. They found that 13% of faculty members answered that they feel unsafe to be around students with mental health issues. Half of these faculty reported that they would not feel comfortable dealing with a student exhibiting symptoms of mental illness. And 10% of faculty are very, very uncomfortable with such interactions. So it's not even an issue of whether or not these faculty members are trained. It's whether these faculty are even willing to be around students in mental health crisis. And that can be very concerning. Now, for the faculty who are willing to learn how to recognize signs of distress in students, universities have to be able to provide comprehensive resources and adequate training for faculty, not selective faculty, because if you make it voluntary, the people who attend the training are the ones that attend every training, and they don't need additional training. And we really have to reach every faculty in the institution. So it's very important for universities to provide trainings, but also support for faculty. So mental health resources for faculty, because caring for others can be very exhausting. So it's important for universities to also provide support for faculty members as well. So we've gone through background of health profession students. We talked about factors that impact health profession students' mental health. We looked at obstacles that prevents health profession students from seeking mental health support. We talked about the current status, the current landscape of health profession students' mental health. And we looked at currently faculty's ability to deal with students in mental health crisis. We have to do something about all of our findings because the findings can be kind of dreary and depressing. And so in the following sections, I'm going to talk about 5 recommendations for a way to improve health profession students' mental health. The first recommendation is designing and implementing programs that can improve student resilience. From our prior research, we saw that the student resilience score is relatively low and we want to make sure that we do something about that. Very importantly, we want to start thinking about these programs and present these programs to the students before and during orientation, because that's when we're able to actually set the tone for our culture. So during the summer, we ran at Penn Dental Medicine, we run a summer institute program where we invite all of the first year didactic faculty members to come and give a presentation to the incoming students to discuss what is included in their courses, what their expectations are, and how students can prepare themselves during the summer to be a better candidate once they get here. And we also want to make sure that within that summer institute, we involve current students, because they're the ones who have just gone through what the incoming first year students will be going through. So we have current second year students who come in to serve on a panel. These students can ask the panelists any questions they want, and the panelists talk a lot about kind of what they expected before they came to dental school and what it really was for them. So there's nothing better than students hearing from other students. So the program has been extremely successful. This will be our third year running the program. It is not a mandatory program because we understand that students have commitments during the summer before they start dental school. So while it is not a required activity, we see that over 90% of incoming students actually participate in this. And while we're thinking about building resiliency programs, we want to make sure that these programs are built into the curriculum, because the last thing we want is to give students more things to do on top of the already extremely rigorous curriculum. So we want to make sure we allow time for self-care and resilience activities within that curriculum itself. So that is the first recommendation. The second recommendation is designing trainings and programs for faculty to be able to identify students in crisis and be able to refer them to appropriate resources. As we talked a little bit about earlier, there are many different camps of faculty's role in academia. Some believe that they're only there to provide education. Others believe that they should be equipped to address students in crisis. I kind of fall somewhere in the middle. I feel like faculty should have the ability to identify students in crisis and know the different resources they can refer the students to, but I don't believe that faculty should be the one to address students in crisis, and I don't believe that faculty should be burdened with solving students' problems, because we have to be able to give students the agency to solve their own problems. Interestingly, in 2023, there was a student voice survey that showed that 42% of respondents actually attributed to the responsibility of their mental well-being to faculty members. And this is kind of compared to the low percentage of respondents who thought that this responsibility should fall on professional counselors, peer mentors, or even administrators at their institutions. So really the majority of the students believe that faculty should take on that responsibility. So there are a couple of things to consider when we develop a faculty training. I firmly believe that this training needs to be integrated into the onboarding process for new faculty members. New faculty members really should be introduced to the different resources, the administrators that kind of help support students in crisis so that they know who they need to refer students to, as well as really understand kind of the mental health one-on-one course, understanding how to identify a student in crisis. And I also think it's equally important for there to be incentives for faculty members who participate in these training initiatives. For example, I know that most faculty members need to obtain CE credits after they graduate from their respective schools or fields in order to continue to practice as a practitioner. And so we could potentially provide them with these CE credits in order for them to be more on board with attending these trainings. So that's my second recommendation. My third recommendation is creating meaningful peer and faculty mentorship programs. As we talked about earlier, faculty mentorship is crucial for health profession students' mental health. Having this mentorship for students is important for them to really kind of improve their mental well-being. Because of the distinct nature of the health professions fields, these students need mentorship even more. Now, in order for faculty members to be able to provide that mentorship to the students, we have to be able to provide faculty with the structured training in order to make sure they understand what a mentor's role is and how to provide supportive mentorship to these students. We want to make sure that we actually establish accountability so that these mentorship initiatives can be sustained in the long term. And we all know that mentorship really helps with graduate student development. It helps with foster personal growth. It assists the students with their professional identity formation as well as resiliency building. But we have to make sure that we actually provide faculty members with the appropriate tools that they need to be able to provide students with supportive mentorship opportunities. The next recommendation is putting equal emphasis on emotional well-being and academic success. Wellness and mental health should never be regarded as a secondary thought. I feel that most students feel that way as far as how their institutions view their mental health, is that people feel like wellness is always a secondary thought, is not integrated into the curriculum. And so we want to make sure that wellness programs and self-care initiatives are integrated into the curriculum. We provide students with opportunity to do that within the curriculum. We want to make sure that we provide a supportive environment for students to encourage open discussion. We also want to make sure that they understand that their voices are heard, at the same time help them learn that just because we want to listen to their voices doesn't mean that we're going to do everything they're asking for, right? So there's a big difference between, students thinking their voices are not heard versus not implementing every single change the students are asking for. Most importantly, we want to make sure that we destigmatize help seeking and counseling for mental health issues. Last but not least, we want to make sure that we establish a collaborative network for student affairs professionals. We should have dedicated meetings that prioritize student well-being so that each of these student affairs professionals who work with students in crisis can exchange best practices. Currently, many of us go to different annual sessions or different conferences, but many of these conferences focus on clinical research or basic sciences research. Not enough focus is placed on student well-being. So we really should make sure that there's enough time and opportunities for there to be exchanges of ideas to support student well-being. And again, similar to what we talked about earlier, these meetings should encourage open dialogue and discussions, but also for us to have the opportunity to bring these discussions back to our senior administrators so that we can implement the changes that need to be implemented. Now that we've kind of talked about essentially everything I wanted to discuss, I also wanted to discuss a little bit about gaps in the literature and some suggestions for future research. First and foremost, the imposter syndrome research right now focuses primarily on medical students. More research really should be focused on other health professions fields. I know that I focus a lot of my discussion on medicine and dental. I do believe that more emphasis should be placed on other health profession students. There has to be more focus on students of color because students of color experience a unique set of challenges. And so future research really should figure out ways to support these particular students. And last but not least, I think there should be a large-scale survey on improving the mental health of health profession students, because right now, either the research the research that exists are from foreign countries, or the research focuses on one single school. And there really should be a large-scale research that focuses on surveying students from all over the country so that we have a bigger sample size. Thank you so much for giving me the opportunity to go over my research, my literature review. I'm really passionate about the topic, and I'm really excited to see what we can do in the future to help improve the mental health of health profession students.